A recent study said people over the age of 45 should consider not shoveling at all. Joining us now, Dr. Brett Nowlan, a cardiology specialist from Hartford Healthcare. Dr. Nowlan, thank you so much for being with us.
Thank you.
Unfortunately, this is a real reality, and it is a real threat when people go out and decide to shovel. A recent study saying that people over the age of 45 are especially vulnerable to this. Why is that?
So you're right, this is a real problem. Today in Hartford Hospital, we saw 4 acute heart attacks, all related to shoveling snow. So this is a real problem. And that number, that 45, that actually comes from a few decades of research by Dr. Franklin that produced this data. And that's where he saw an inflection up in the risk of actually having a heart attack. You know, unfortunately, by 45, most people have at least one risk factor for cardiovascular disease, like high blood pressure or high cholesterol or smoking. And so that's why we start seeing the problems at that age.
What is the reason that shoveling could cause such serious health effects? You think of it as just, a simple motion. You go outside, you pick up the shovel, you shovel, and you move on with your day. What's the difference here?
You got it. It's very deceptive. Shoveling snow is a very cardiovascular exercise. And they actually estimate by 2 minutes into vigorous shoveling, your heart rate and your blood pressure is the same as at peak stress tests. And you add to that the very cold weather and the cold air that you're breathing in, it actually makes your arteries clamp down. And so that combination is actually lethal. And it's also in winter months where people are less hydrated and maybe they have had influenza or other viral infections, which raises risk. It's a real problem.
What are the biggest signs when people head out to shovel that they should be looking for? Are there certain symptoms that would make you go, okay, let's sit down for a while, this is not going well?
Yeah, you got it. So things like central chest pain, like a squeeze or a pressing feeling or a burning feeling. Sometimes people feel that in the neck or in the jaw, sometimes down the left arm, sometimes between the back, shoulder blades. Things like feeling very short of breath that's just not going away, or nauseated or vomiting or profuse sweating. Those things, if you have symptoms like that and they last for 10 or 15 or 20 minutes, you really should be calling help. In other words, calling 911.
And lastly, quickly here, doctor, what would your best advice be if people they don't have a snow blower, they don't have someone who can plow for them, if they do have to go out and shovel, what do you recommend?
Yeah, please make sure if you have a prior cardiovascular history, don't. If you're feeling sick, otherwise, don't. Other than that, try and bundle up, try and cover up so you're not breathing in cold air. Take it slowly, small shovelfuls, maybe push the snow rather than actually lifting it up. But best of all, if you have a prior history, rather avoid it altogether, if possible.
Well, thank you for bringing awareness to this, a very serious issue that we deal with every year here in New England with the snow. So we appreciate you being with us.
Absolutely.
Dr. Brett Nowlan with Hartford Healthcare. Thank you again.
Thank you so much.